I think one of the things as women that really holds us back is that we think that we don't have control over our bodies. We think that we have to outsource all of our care, but this is not true.
I'm not against the pill, I'm just for consent and patients knowing what can this do to me and then being able to choose if that's what they want to do.
When your fertility is on the line, it forces you to look at your cellular biology, the longevity of the human system.
Hi, and welcome back to Proven, healing breakthroughs backed by science. In this final episode, we're going to be venturing into one of the most complex and vitally important realms of our body, our reproductive system. Now, when I say reproductive system, the mind might harken back to 8th grade health class where we got our official whiteboard lesson about the birds and the bees. But reproductive health is far more than just making babies, which is a huge thing in and of itself. So many underlying parts of our physical function directly affect or are affected by our reproductive health. Whether it's overall hormonal balance, and I'm not talking about just primary sex hormones like testosterone and estrogen, all of our hormones, known as chemical messengers, are in a beautiful but delicate balance and can impact one another. So sex hormones can affect hormones in your brain that dictate your mood in either a positive or a negative way. Reproductive health can also mean pain or lack of pain in your pelvis and surrounding regions. Did you know that up to 30% of women live with chronic pelvic pain? Why is that? And is there another way out? These aspects of reproductive health, including, yes, better sexual function and intimacy, are where we're going in episode 9. One more thing. This episode is for both women and men. We'll be taking a few side excursions into some fascinating and powerful therapies for women, but these are also empowering to men as we try to be stronger and more informed partners in our relationships. It takes two to tango, and the more we know about the other, the more we can enjoy and support one another. Lastly, it's important to understand that this component of who we are is the culmination of almost every other area of our health, and in many ways, it's a canary in the coal mine. When we're experiencing difficulties in any department of reproduction, there are often a series of other underlying imbalances, near and far, that we need to uncover. Are you ready to dive in? Let's go.
The pelvic floor is the basin. It's the basket of your being. It's highly energized. It holds your organs up. It has a big, deep sexual function. It plays a part in stabilizing the pelvis, the lumbar spine. It also has a lymphatic function, right? So it is incorporated into almost every aspect of your life, and it's involved in all motions of the body. And it's also, responsible for beautiful orgasms and connections, and for women to really feel deeply intimate, the pelvic floor muscles have to be in good shape. 30 million women in the US suffer from pelvic floor pain, 1 out of 3. And it can express itself in so many different ways. It can be low back pain, it can be sciatica, it can be sacral pain, it can be pain with initial penetration, it can be pain with orgasm, it can be pain with sitting. Because these muscles are so intimately connected with the upper and the lower extremity, it can affect multiple systems. The truth is that 50% of older women suffer from pelvic organ prolapse. The truth is that 49% of women leak on themselves. The truth is that 1 out of 3 women suffer from chronic sexual pain. I treat a lot of men too, 40% of them, I treat 40% men.
Really?
Yeah.
With pelvic floor pain?
Yeah. Men come to see me in New York City when they have erectile dysfunction, when they have pain with sitting, when they have frequent urination. Most of the time they come to see me when they can't sit through a meeting. They're leaking when they're coughing, sneezing, or laughing, or just uncontrollable leaking after a prostatectomy. But many of the men that I saw was for pelvic pain. But it's not over. There's so many natural things that you can do to help yourself.
So your hormones are messengers in the body. And as you can imagine, everything is connected to everything through these messengers. And so most people think that you have to be female to have a hormonal issue. Every single child from being in utero needs proper hormonal health for growth and development of their brain, of their nervous system, all the way to an adult who is aging, and their thyroid function, their insulin, their blood sugars, everything is affected by hormones. So I always say, if you have a symptom, you have to address and check and look at your hormonal system, because if their messaging is off, you don't also want to just pause there and fix it. You want to understand, why is my body giving this message in this system?
So everyone's talking about hormones, and yet everyone's talking about hormone replacement, and nobody's really thinking about, well, what's going on with our hormones in the first place? Why are we all needing to replace the hormones? The reality is that our lifestyles are maladaptive to healthy hormone balance because we're all stressed out. And if we want better hormones, and specifically sex hormones, I'll talk about those, we need to address the fact that our bodies will always prioritize survival over reproduction. And so realistically, your body, when you're in a fertile age, first it has to say, okay, am I safe? Great. If I am safe, then I can reproduce. That's a hospitable environment for a baby. Now, if you're really, really stressed out, and you see this in a lot of women who are struggling with infertility, even just the stress of the struggle of infertility makes them even more stressed. And then the moment that they stop trying is the moment that they get pregnant. And that's because their body finally has just been like, okay, I'm relaxed. I can let go. So much of our hormone balance is really relates back to our stress response. With hormones, it's really important to always begin with questionnaires of symptoms and testing. Do not fly blind when it comes to hormones, because fundamentally, you need to know where your imbalances are, right? Do you need more DHEA? Do you need more estrogen? Do you need more progesterone? Do you need more testosterone? So testing is really important.
What is my body telling me? And do I listen? Do I have that quiet space to understand these symptoms? Or am I just in that go, 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 flight or flight, try to make money, try to get married, have kids, buy a house, get a car, do all the goals that you think are important in life? And the hormones are there sometimes to slow you down, and we don't have the time, or I guess the skills, to process that information correctly, and so then they go more out of whack.
All women should be listening to the cues of their body and know that you're not alone, that you're actually in the majority, and that the moment that you realize that you're not alone, and the moment that you know how to care for yourself, that is the moment that you'll be free. And to always think about working with a group of individuals that can help you to be the best version of yourself.
We're going to kick off this episode with a powerful healing technology that you may remember from earlier episodes. It's called biofeedback, and it comes in many forms for specific areas of health. As you're about to see, it can be a true life changer when it comes to a certain challenge that many men and women face.
Biofeedback is a technique by which you monitor what happens inside your body using all kinds of equipment or whatever, and you display it back to yourself so you can see what is happening inside in your physiology. It makes the invisible visible. One of the areas already early on showing that biofeedback could be really a remarkable tool has been for urinary incontinence. It works out that a number of women after childbirth leak urine easily under any pressure. That's called stress incontinence. It doesn't mean psychological stress, it just means pressure is applied on the bladder. That pressure is more than the sphincter strength, therefore you leak a little bit. So when you cough, you leak. When you laugh, you leak. Or when you jump, you leak. Or play tennis, you leak. And that often can get worse. And as women get older often, they may develop more incontinence. So do men sometimes after prostatectomies. And then therefore they wear adult diapers, which is $1 billion industry. It works out is that the concept often is seen as structural. And this concept of structural versus functional is critical. A structural concept says it is fixed. There's nothing you can do about it. At best we can give is medication, we can do surgery, we can adjust it, we can give you supports.
When someone says, hey, do a mesh surgery, when someone says, hey, do a lifting for the bladder. When someone says, I'm going to inject something into your vagina, that is the moment that you have to be like, okay, what is the informed consent here? What are my options? And get a second and third and fourth opinion, because sometimes pelvic floor dysfunction and pelvic pain can make a woman desperate. It's understandable. It can ruin your entire life. I've been there, I know it. And I've been through many of these procedures myself. But I didn't know. And I think when you know better, you do better.
A functional perspective says it's how you're using yourself. So if you use yourself differently, develop different mastery, then possibly the system can heal or fix itself. A reason why a number of women after childbirth develop urinary incontinence is that during the delivery, the tissue may be torn, they may get an episiotomy, and it hurts. Now when it hurts, without any awareness, you learn not to tighten the pelvic floor. Because the moment you tighten, it's like all of a sudden the area that was torn hurts, and so you have single trial learning. The moment you tighten, you feel pain. What do? You don't tighten. You don't even know you do that. Absolutely, you're totally unaware. It's unconscious. It's called learned disuse. Now what you do after the delivery, often you teach people Kegel exercises for women, but even those may not work because the person may think they're doing it. They tighten the pelvic floor muscles. They think they're doing it, but unless you measure it, you would not really know if they're doing it. And they may be tightening the wrong muscles, like their buttocks, their stomach, and they think they're doing it. So now with biofeedback, what you can do, and there are many different strategies, but the classic one is the woman would insert a sensor, a muscle sensor vaginally, or males would do it rectally. And then on the screen, they would see the muscle tension. So now you have the screen, you see the muscle tension, you say relax, the muscle tension is like this. Now you say tighten. And now they try to figure out ways to tighten to get the signal up. So now they're getting appropriate feedback. And they do this. And what you see is that on the average takes 4 to 6 sessions, you have an 80% success rate. It's mind-boggling.
I think one of the most important things that women can do for themselves is exercise their pelvic floor muscles. Now, everybody wants to do Kegels, right? And Kegels is a contraction of the pelvic floor muscle. All the 4 walls of the muscles come in, but they also lift up. But Kegels are not for everyone. Some women who have pelvic pain should be doing something called a reverse Kegel. And a reverse Kegel is really simply breathing very deeply into the vagina and imagining that it's opening up and relaxing and blossoming like a rose in the springtime. So breath work is really important. And many women who suffer from pelvic floor dysfunction have paradoxical breathing, which means when they inhale, the belly flattens instead of expanding outward. So one of the critical things is, how are you breathing? And can you correct that faulty pattern? Because once you can correct that faulty pattern, then you can do Kegels and reverse Kegels the right way.
Every city in the United States should have a clinic like this, or a therapist like this who does this pelvic floor work. What makes biofeedback unique is that it provides the person with information about themselves to increase awareness, and it really generates a sense of hope, because all of a sudden you can see, I'm doing something which I was totally unaware of, and I'm changing it. We often just think we have no control. And what this allows us to do is to say, gosh, in a certain way, we can develop a sense of awareness and then mastery by which we can affect our health and wellness in our being.
Next up on our journey into reproductive wellness is another technique that's been highlighted in earlier episodes. Because of its versatility and overall effectiveness, the use of acupuncture to boost fertility and help couples conceive is extremely well documented. I've heard more than one TCM practitioner tell the tale of an older student who thought they were infertile but became pregnant unintentionally later on in life, sometimes in their late 50s, during stretches of time while they were practicing acupuncture on themselves. There's plenty of good science on the powerful effect that acupuncture has on reproductive wellness, and we're about to discover exactly how it works.
So just a couple of months ago, a very large, high-quality review came out, and there's a reproductive health researcher by the name of Lee Hollander Rubin who was looking at the effect of acupuncture on live birth rates following IVF, and she found that acupuncture significantly increased the chances that a couple would have a healthy live birth. I believe it was by 2.5-fold.
I've dealt with a lot of fertility cases back in my clinical days. It wasn't fertility that was the problem, it was the person that was the problem. So you have this toxic, stressed out, wound up person coming in sympathetic dominance that has been in fight or flight for a couple decades at least, or has been on hormonal therapy called birth control since they had their first period. And everything's just kind of whacked out and they're wondering why they can't slam on the brakes and just get pregnant. And they're trying to do, it's like trying to do sleep. You can't do sleep, you fall asleep. So getting pregnant happens to you. It's not something you do. And so I think fertility has been a very powerful place for acupuncture because acupuncture regulates some of that gene expression and allows the body to relax and heal. And when you're in that PNS dominance, that's when we find people are getting pregnant easier.
Our endocrine system, our hormonal system, is highly sensitive to the environment, both external and internal. So anything that we can do to stimulate it to go back into a healthy, resting place is going to have all of the benefits that we would want. So for IVF, we're going to get increased blood flow to the uterus. We're going to get reduction in stress physiology, which has the effect of making us constrict. So it constrict our blood vessels, constrict our muscles. When our nervous system and when our body knows that we are relaxed and we're safe and we're doing good, then the functions of all of these things improve. And I think that that's why we see the benefit in the outcomes.
Acupuncture and hormone regulation and also addressing infertility, I use it. Patients typically have to come in and see me once a week for at least 6 to 8 weeks, depending on what's going on. When it comes to infertility, a lot of change has occurred since I've been a practitioner. The first patient I had, I think, was in maybe 96 or 97. So IVF was around, but it was not a thing, and it was expensive, and it was in the very early stages. And so we were taught a lot in school about how to help people get pregnant just with acupuncture and Chinese herbal medicine and diet. Women would work with us for anywhere from 6 to 12 months to get pregnant, and they would. It just took time. And in hindsight, I look back, and the number one thing I think I was dealing with was stress. The body actually did know what to do, but stress was affecting the body's ability to do what it needed to do. There were some studies done in the 70s, I believe, the first studies, on the efficacy of using specific acupuncture points to support an IVF process. And so they would do these points before implantation and then afterwards. And the efficacy was pretty good. It's great. And to this day now, many fertility clinics are using on-staff acupuncturists to help support the IVF process.
What we see is a huge explosion in the percentage of IVF clinics who are offering acupuncture in-house. And I think this really speaks to the success that people have had, and they share what they've done with other people, and it really grows that way. And I think what's important from a research perspective is that we're able to identify best practices and what's optimal. So I've seen studies that have looked at acupuncture and its effect on IVF outcomes by doing a single treatment. And I think that study probably found negative results, which is sort of what I would expect. So any treatment, it needs to be adequately dosed. So acupuncture has been shown to have phenomenal results on balancing hormones and helping optimize hormonal health, both for men and for women. But we need to make sure that we're studying it in its best light, that we're doing adequate treatments, appropriate treatments, enough treatment that we're going to give it a chance to work. But when we do, what we see is that it is effective.
What's interesting to me over the years now, I'm seeing more unexplained infertility in my clinic. And these are women who have done an IVF cycle or 2, maybe 3, and they're not getting pregnant. And there's seemingly no answer as to why. All the testing on their hormones, everything comes out fine. And IVF is a very controlled process. And so its outcomes are good because it is such a controlled process. So these cases of unexplained fertility, they kind of get left out in the wind, right? So that's who I now get in my clinic. So I might work with someone getting ready to do IVF, which is fantastic. It's wonderful to get some acupuncture for several weeks leading up to IVF because it balances the body as well as we can before it goes into this wonderful process of hormonal manipulation.
How about we relax the system and we heal the body and let it do what it's innately supposed to do, which is take the genetics of your progeny and move them into the future generation. And when that isn't working, then we have to question what's happening with this biological system and whether or not it is capable of moving forward in time into another generation, or whether it is a dying carcass trying to survive and stay alive and make ends meet with its bills.
So I'm a teenager, I'm 14, 15, 16. I never had a period, which is not that unusual. This probably won't get in the movie because no one will talk about periods, but it's not that unusual. Maybe it's less than 10% of the population. The regular medical treatment at the time was different types of hormones. So I was put on straight cow progesterone, they gave me a shot, and different things that aren't even on the market anymore. That made me gain a lot of weight, and I got depressed. I mean, these drugs did things. They didn't do the right thing, but they did things. And then once I got to college, I stopped that because I could, and still didn't have a period. And then fast forward till I was 22, I got mono. And I went to my regular doctor, and she said, well, don't run and eat better and sleep better. And she had nice things to say, but not any cure. And a girlfriend of mine who worked as a receptionist in an acupuncturist office just bothered me. Go see Dr. Pong, go see Dr. Pong, go see Dr. Pong. We could not have a conversation without her saying, go see Dr. Pong, her acupuncturist. So I went to see Dr. Pong and really had Chinese to me was a food. So he had the medical interview, and I was very impressed with the depth of the medical interview. It wasn't just, what's this symptom? He took like an hour. He talked to us about dreams, taste in the mouth, just relationships of things that I didn't even know anybody thought about. Got me on the table, and he put the needles in, and of course, you're supposed to lie there and be calm, and I'm looking, it was hard for me to lie down, and I had a needle in my hand, and I was doing this, see, does it come out? And he came up to my head, and he patted my hand to put it down on the table, and he said, we'll take care of the period too. And I fell asleep, because I usually fall asleep with acupuncture. I pretty much always do. I remember thinking as I fell asleep, no, you won't, because you don't know the drugs I've been on. 2 weeks out of period. And as long as I took Chinese medicine, I had a period. I was a normal person. So that was interesting to me, because that, at least in my idea then, what placebo is, it couldn't have been placebo, because I didn't believe that it would work.
We see that acupuncture is optimizing the regulation of our hormones through that hypothalamus pituitary adrenal axis, and we can actually add on to that gonadal thyroid. Essentially what we're looking at is this top-down and then circling back regulation and harmonization of the hormones in the body.
The main thing that comes to mind when we talk about hormone regulation is menopause, right? So perimenopause can last several years, and women can experience some really uncomfortable issues around that, like hot flashes and night sweats, which come a little bit closer to the menopausal process, but perimenopause can certainly create excessive moodiness, sleep disruption, irritability, and having acupuncture on a regular basis can definitely mitigate a lot of those uncomfortable sensations. Because I think of what's happening hormonally during the perimenopause and menopausal processes that recently I referred to them as tectonic plates within our system are shifting, right? And there's like this jolt, and it's just the person's like, oh, what just happened? Like I'm really grumpy, and I just snapped at my coworker, and I don't understand why. That's a classic example of this hormonal shift that happens on a deep level, and acupuncture can help the body manage that shift. It doesn't change the shift. The shift's still going to happen, but it can definitely help the body adapt to the shift.
We humans have been trying to find hacks for better lovemaking since the dawn of time. Whether it was the ceremonial hot chocolate concoctions consumed during Maya wedding rituals, or the secret weapon of legendary Italian lover Casanova, eating oysters to give himself extra virility. And why not? It's a central part of human adult life. But what really works? In this next segment, we're going to be getting to the bottom of that age-old question with some powerful medicinal herbs that are known to enhance romance.
So one of my favorite herbs to use for fertility is maca. If you actually go on PubMed, there are several products. I use the Feminescence brand for fertility. The Harmony that they have in there, it's called the Harmony Maca. There's 13 different roots of maca. You've probably seen maca at a health food store, but there's research that this helped women who didn't have their cycles regulate their cycles and get pregnant. So maca is I say, the Peruvian ashwagandha, but when it comes to fertility, I love that there's actually some science and evidence that this was used in a clinical study in women to help them with fertility. And then there are different roots that are more for men that can help with testosterone. So they have maca for men, they have ones for perimenopause versus menopause. So different roots are used looking at their constituents of estrogen to progesterone to testosterone. So I encourage people to look at that maca versus just getting any maca without knowing, which root it is and what age group it's good for.
Ashwagandha, over the past maybe 5 years, has all of a sudden become incredibly popular. And there is a great deal of research, much of it coming out of India. Traditionally, ashwagandha was used in Ayurveda as a male reproductive tonic. And there's indeed research on that showing that it enhances sperm count, sperm motility, has modest benefits for erectile dysfunction, although there are other herbs that are even more appropriate than that. For instance, red ginseng happens to work better there. So for men with infertility, because of low sperm count or poor sperm motility, it could be very useful. But one of the things that people often talk about, they talk about men's herbs and women's herbs. There's no such thing. Any herb that affects a man works on analogous tissue in women and vice versa. So more recently, a study was done on ashwagandha looking at its ability to affect women's libido. And it was shown that ashwagandha enhanced postmenopausal libido in women. So it is an herb with a remarkable set of activities. And here's an herb that's been used for thousands of years in India, and research is showing that virtually everything that the ancient Indians said it could do, it can do, and probably more.
I use a lot of chaste tree in my practice, Vitex. So this is an herb that can help the LH-FSH ratio. So many women for fertility. You want to be careful if you're on birth control pill and you take chaste tree, it can actually negate the whole purpose of the birth control pill and you can become pregnant. That's how powerful it can be. It helps boost that second phase of the cycle, which most women have issues with, the luteal phase, or that second 2 weeks before your period is due. That's often when we see a lot of PMS, or sometimes the cycles get shorter in women, and that's because that second phase isn't long enough because of an egg quality issue, for example. So if it's the egg that when you ovulate, if the quality isn't as good, let's say from aging, you don't release as much progesterone, and Vitex or chaste tree can help regulate this on a more pituitary level. It changes the LH-FSH in that patient, and I've seen it be very, very successful, even in women who are coming off the birth control pill and their cycles are irregular.
A lot of women don't even realize that they're at the beginning of perimenopause because it can start in their 30s. Women start having changes with their hormones, and what happens is you start to see there's a little bit of a drop in progesterone is one of the hormones that oftentimes starts to go down first. And so herbs like chaste tree berry can be very beneficial to help support natural progesterone levels and create more of a hormone balancing effect for women, especially in those early stages. And that's oftentimes where I see women when they might be actually developing acne they haven't had in many years. They might notice that changes with their cycles. And so chaste tree berry can sometimes be a good one to start with. It's important to individualize, though, for when it comes to herbs. There's not a one-size-fits-all for all women.
So the value of Chinese herbal medicine is that we use the herbs in formulas. If we are able to use a combination of herbs that can cover multiple bases, if you will, you create this synergistic effect and you'll get much better clinical outcomes, and people will understand the value of using Chinese herbal medicine much more. I often hear in my clinical practice, oh, I took dangui. Like dangui is like the women's herb, right? And it's noted for its ability to regulate the menstrual cycle. That's a big statement. It's a very generalized statement. And I've had people say, well, I took dangui for 4 months and I ended up bleeding between my periods. And I'm like, that's probably going to happen in your situation and because you use the herb by itself. When used in combination with other herbs, dangui is incredibly effective. But it can be problematic when used alone. It can actually create an irregular cycle, or it can create digestive upset. And of course, a person's going to stop taking it, and then they say, well, it doesn't work. And it's like, well, in the context of how you used it, it doesn't work. But if you use it within a formula, it's a brilliant herb. I know for me as an herbalist over the years that's been challenging is the marketing that happens in the herb and supplement industry, which is very misleading, but also the potency of a lot of products is not there. And the active ingredient is in there, but it's not enough. And so someone will spend $30 on a product, take it for 2 or 3 weeks and be like, this is not working. And so then they think that the specific herbs in that product are not working, which is true, but it's because of the delivery method, it's because of the potency, it could be the combination that was being used, and so then they end up with a kind of a negative experience. And so dose and potency matters, and go to someone trained. Whether it's a Western herbal medicine person, a naturopath, or a Chinese herbal medicine person like myself, if you go to someone who's trained, not only are you going to get better advice, but you also do have access to better products, because there's a lot of products that we can buy that you can't buy, and they are much more superior in their potency.
In the special part B of this segment, we're going to explore an ancient practice that is experiencing a big resurgence in the wellness world. It involves the use of herbs and steam to cleanse, nourish, and heal our reproductive organs. The practice is called herbal steaming and can be extremely beneficial for both women and men.
A yoni steam is using steam. Sometimes there are many different types of herbs that you can use in the steam. I like lavender and rose. So that's one of my herbs that I use in my center. So with lavender and rose, I'm looking for relaxation of the pelvis, but I'm also looking for the mind-body connection. And I'm looking for a sort of like an increase in mood, happiness. A woman will sit in a chair, right? She will prepare the herbs. And the herbs are in a really nice, steamy kind of way. Sometimes we have chairs. I used to have this one chair that I used to call it the queen's chair that I had this guy develop for me. And I would put the herbs underneath the chair. The woman has to be completely covered because we don't want to have any wind go in. Socks on. Don't be on your cell phone when you're doing the steam. It just sort of kills the whole mood of that. And when you're doing the steam, you're in a real deep state of meditation. What I like to call vaginal or vulva meditation, where you're connecting deeply to the pelvic floor and breathing into the pelvic floor so that they're relaxing and opening as the steam is gradually going in, and the steam, like vapor or heat, is softening things up and bringing more circulation to the area. So that's really the gist behind yoni steaming. When it comes to vaginal steaming, there is not a lot of research, but this has been my clinical experience. When women have deep pelvic pain, when I'm taking them through a progression of stretching and opening them, right? Heat is in the literature, right? What does it do? It brings circulation, it softens tissue, it relieves spasms, it relieves trigger points. So when I have women who are super tight and have a lot of pelvic pain, I incorporate yoni steaming or vaginal steaming into their protocol. And what I find is that the women can more easily stretch out their pelvic floors and then insert something that I call dilators to open them up, right? Because typically women with pelvic pain have a lot of hypertonicity in the pelvic floor and have a lot of tension. So yoni steaming allows the area to sort of breathe and to increase more microcirculation to it. So I've seen women after a steam, and I hook them up to the biofeedback, and their tension level decreases dramatically, right? So at the end, I have to still be a scientist, right? Because there isn't that much literature. And the women just feel so much more vital and have better sensation in the pelvis after yoni steaming. And I personally love them. I believe it's been around for thousands of years in all cultures. One of the reasons why yoni steaming is not as popular in the US and other really developed countries, I think it's because there's a big disconnect, right? I think that women are not taught to really care for this body part. We're not taught these things as we grow up as children. But in other countries where we don't have these readily available medications, women have to resort to alternative means to care for themselves. And one of the reasons I think that women are really disconnected from yoni steaming in the US and abroad is because we're just not taught. It's something that it's not spoken about, right? Because what do? We go for our yearly checkup, we get on birth control, we're like, we're good. That's it, that's all we need. But that's not true. We know that that's not true now.
I hope you're enjoying tonight's episode. We'll get right back into it in a second, but I just wanted to take a quick moment to tell you how you can own the entire series. Below this video, you'll find a link to the full Proven docuseries, as well as a bunch of powerful bonuses that you can bring into your home at a special discounted price. This also includes a Proven companion guidebook that's jam-packed with powerful takeaways and action items from each episode. It's loaded with deep dive wisdom that isn't included in our free premiere. On top of that, we're hosting 2 live Q&As where you can ask questions directly to some of the renowned experts you see in these episodes. If you're interested in bringing these powerful, proven healing solutions into your life, it's well worth checking out. Plus, the proceeds from your purchase will help us on our quest to unveil new breakthrough medicines and share this information with the world. Make sure to check it out. Now back to tonight's episode. We all know that exercise is good for us, but yet many of us still have a hard time finding that extra 30 minutes to an hour in our day to get our body moving and work up a sweat. It's a problem that our ancestors mostly didn't have because they worked with their bodies more, walked more, and were kept trim by a much less predictable food supply. But in our seated stay-inside culture, this lack of planned exercise has become a real problem, contributing to a rise in a number of chronic diseases, including many reproductive and hormone-related disorders. The good news is that there are some easy movements we can do on a regular basis to turn it all around.
Muscle is the largest organ in the body. It's really interesting. We think a lot about testosterone and muscle. Testosterone in muscle is valuable. However, estrogen and thyroid in muscle is also valuable. And a lot of women end up gaining weight around menopause. And one of the reasons this happens is a decrease in estrogen and an increase in thyroid binding globulin and a decrease in thyroid. When all of these things happen, your metabolism changes. And it also changes your ability to utilize substrate in the muscle. So you don't utilize as many carbohydrates as you used to. Your muscle tissue isn't as robust as it used to be. And these are in part due to changes in estrogen, testosterone, thyroid hormone. So balancing those hormones is really important to maintain that tissue.
One of the things that we know absolutely is a fundamental building block to energy is muscle density.
But in general, for women, I find too many are doing cardio and they're overexerting themselves, and it's actually a stress. Exercise is a stressor on the body. And so how well you recover is what's really key. I love resistance training. I always ask my patients to be lifting and building muscle, especially to help as they're aging with testosterone levels. You know, for my men, there's tons of research looking at exercise, especially for people who have more muscle mass on their body. So if you're running and you're not necessarily building muscle or eating correctly after to get that protein in that the muscle needs, That's key. So what I see in practice often is people will say, I'm exercising a lot, I don't feel good, I'm tired. So if they're overdoing it, that can be a stressor. And I'll say, just do 20 minutes, 30 minutes of high intensity interval training or resistance training and lifting. A lot of women are scared. They'll say, I don't want to build muscle, I don't want to look bulky.
So the myth is that you're going to start working out and bulking up. That's not going to happen. Every time I hear that, it's like saying, well, if I put a lot of gasoline into my Honda, it's going to become a Ferrari. It takes a ton of dedication. It's a full-time job to look like a bodybuilder.
So I would say start finding things that actually help you build muscle mass and measure your muscle mass. Get an in-body test that looks at your muscle and your fat. And don't try to lose weight, try to lose fat and build muscles. My other favorite is detoxification through the lymphatic system. So moving the lymph, helping your body detox naturally is key to hormones, and it's key to everything. So the lymphatic system barely gets any credit, but this is like the garbage guys. Like if you don't have 1 week, have the truck come and remove your garbage, and then it just keeps building up and building up. You could be eating all the right foods and you could be cleaning your house as much as you want, but it's gonna stink, it's gonna back up. And so many of us have this backed up system, and we're sitting a lot. So the lymph is under your arms, in the groin, and just look at me right now, they're completely not moving. And so I love rebounding. I love anything that moves the lymphatic system.
The way you carry your body is really, really important. Like, for instance, you don't want to sit all like slouchy and sloppy. You really want to sit up nice and tall and straight because you're sitting on your pelvic floor. So I recommend all women who have pelvic pain have proper ergonomics at work and at home, right? Because many times we're sitting with our laptops in bed, and that's not like a complete no-no, right? Or many times we're sitting like really slouchy or slumpy, and that's also a big no-no. When it comes to pelvic pain, there's so many different types of exercises that work really well to diminish the pain. One of the ones that I love is yoga, restorative yoga, or flow yoga, not Ashtanga, not those heavy-duty yogas. Certain poses I think are incredible for women's pelvic floor. I love pigeon. So if you can get into pigeon, if you can't get into traditional pigeon, then do standing pigeon. I like force stretch. I like opening up the chest, right? Because women who suffer from pelvic floor dysfunction or have issues are like this. So anything that opens you up, that connects you to your heart, I think is really incredible to increase the vitality of the pelvic floor. I love breath work because breath is life. And if you connect to your breath, and if you connect to your body using the breath work, it really helps women with their pain. Meditation, all women who see me, I encourage them to meditate, even if it's for 1 minute a day. Think about the activities that are causing you symptoms. When an activity is causing you symptom, at the gym or wherever, then that's the moment that you have to say, hey, let me re-examine. Why is this happening to me? Why am I leaking when I do this stretch? Why do I have pain when I sit this way? And at that moment, when we bring the mindfulness to it, when we start to really go inward and pay attention, deep attention to the messages of our body, then we can do very simple changes. Change your posture, ergonomics at home, change the exercise at the gym. So these are little things that you can do, because all little steps that will bring you the most profound effect for your pelvic floor.
So I specialize in reproductive health, and I believe that there's definitely a place for dance movement therapy in that. And what I look at is, in a way, especially somebody on a fertility journey very often has experienced some sense of loss that they may perceive as their body failing them. And in that, there's this grief that has to happen, and that grief is related to how their body didn't do what they imagined their body should have done. And so allowing you to be in touch with how your body feels with that seems essential in processing that. And I have also seen people kind of come into like that fetal position in their grief, which also feels very primal. So tapping into that primal experience and the sense of being expansive and imagining yourself carrying a baby, and kind of what does it feel like to hold that baby and to be in that space. In the same way, I also think that becoming a new parent is so much about movement. I mean, if you think about what your body goes through, your body actually fully transforms to build the baby, to push out the baby, to feed the baby. But then there's that nonverbal communication that is at the heart of that baby's growth and development and self-esteem. And that parent needs to learn how to use their body as the source of comfort and kind of education and connection with that baby. Because if they don't, that baby won't get what he or she needs. So movement can be really important in that. And there aren't necessarily specific movements, although I really do think about rocking movements. One of the things that in our course of study we have to go through is movement analysis. And in the movement analysis, one of the rhythms we think about is this rocking rhythm being so important and so primal. So if we do this rocking rhythm, it can kind of bring us back to early childhood memories. It can bring us back to this sense of soothing. It's even called an oral rhythm because it feels almost like sucking, right? And so often I will help a mom to grieve by helping her hold herself and rock because it feels so nurturing and primal and often soothing and important in her process.
We close tonight's episode with an area of medicine that really stands out to us because of its A, ease of accessibility, B, long history of use, and C, the stacks of data to support its benefits for reproductive health. I'm talking about manual medicine, or the practice of physically manipulating an area of the body to achieve a therapeutic effect. This is something that is likely as old as we are as a species, potentially the first type of medicine we had access to, and it has stayed with us through the millennia in various forms because, as you're about to see, it works extremely well. This final segment is a two-parter that focuses on two specific realms of manual medicine that both hold remarkable healing potential for the lower centers of our body. We start with an ancient practice that has become a hero in alternative women's wellness communities over the past 20 years. It's called Maya abdominal massage, and it has changed the lives of many.
The uterus is the most magnificent organ in the body. Now, because it's held by different ligamentous tissue, we have to understand, and we know through the science that all organs in the body have their own inherent motion, and that's called motility. The uterus has its own motion too, and it also has a positioning. So many women who have menstrual cramps, who have low back pain, who have hip pain, who have sciatica, sometimes have a posteriorly rotated uterus, right? Some women who have a lot of deep pressure in the pelvis, who have a bladder prolapse or uterine prolapse, sometimes the uterus is tilted anteriorly, right? That's only one dimension that the uterus can move. They can move forward or back, right? But also the uterus can have a little bit of a rotation, which a lot of people don't talk about. And one of the things that I do is I do reproductive visceral manipulation, and I work with the motion of the uterus, and then I try to correct that motility and also the mobility and also the positioning. The great thing about the belly is that it's a blueprint for the organs, right? So if you know your anatomy, and you have to know your anatomy and know these techniques, you can actually tell where every organ is in the belly, and the uterus is no different. With the uterus, I can tell if it's too low, if it's too high, if it's laterally displaced, or if it's rotated. And so sometimes you can do an external technique to get the uterus back in place, but I like to do the combination of internal and external. And then once I get it in position, I will give some exercises to maintain the pelvic bones in alignment, right? Because the uterus attaches to the sacrum. So those are easy techniques that I can show women to do. It's not that complicated. I think all women can learn this. And the self-care work, especially the Maya abdominal massage, I think is really incredible and really helps women to stay connected to this vital part of their bodies and to their vaginas.
Women will have ovulatory pain. So in the middle of their cycle, they can tell when they're ovulating because their ovaries are releasing that egg and they can feel it and they actually cramp or they have pain. That often, I say, is a sign that there's pelvic congestion. And I love Mayan abdominal massage, or any kind of, I even teach patients to do ovarian massages themselves. First, obviously, we want to look and do a pelvic ultrasound and see, are there cysts, are there fibroids, are the fallopian tubes blocked, is there an actual blockage? But you technically shouldn't feel every time your ovary releases an egg. It's a very tight, small region of the uterus and the ovaries. It's very small, but you still shouldn't feel that ovum when it gets released. So if it does, you want to work with someone, a massage therapist, a fertility massage therapist, a pelvic floor specialist that can help open up that region a little bit and not feel that. Mayan abdominal massage is a great way to remove scar tissue blockages. Acupuncture is another amazing way to help with that.
Well, when I learned my abdominal massage, I mean, I'm a scientist at heart, so I did over 100 case studies on my own. It's really interesting. There have been some studies, and I think most of them are performed by Rosita Arvigo. And what I did with my abdominal massage, because I'm like, what is this? Is this some woo? Right? I wanted to prove it for myself. So what I did was I would put the women on biofeedback and do the work and see the response of the abdominal massage to the pelvic floor. And 99.9% of the time, the pelvic floor muscles relaxed. And then I would go and I would do an internal evaluation to see the positioning of the uterus. Because my abdominal massage, one of the things that they say that is the big benefit of it is that it repositions the uterus, right? But because I'm like, well, how do I know that's really true? So I would do a test before I did my abdominal massage to see the position. I would do it after. And then I would be like, now I believe it. And the women, right? Sometimes, it's not just about the proof. It's also about what your patient says and the benefits that the patient says they're having. So a lot of the fertility doctors in New York send women to me so that I can reposition the uterus, and then they go and they do the insemination or their embryo transfer. And these big IVF doctors, so everything is proof and double-blind studies, know the benefit of my abdominal massage. I also think that all women should be stretching their vaginas, just the same way we stretch our hamstrings. So simply putting a finger inside the vagina and pressing downward towards the floor, I think would be really, really important, because if the muscle's too tight, or if the muscle's too tight and too weak, or a combination of thereof, you need to bring back the flexibility of this muscle. And sometimes manual stretching is incredible.
After 30 years as a chiropractor and seeing so many different conditions, I'll give you a case study. A 39-year-old woman came in. She just had so many problems going on, bladder problems. She fell down a flight of stairs when she was 18. Sore for a couple of days, but then nothing after that. But within 6 weeks, she started having symptoms of an irritable bowel syndrome. It got worse. Went to the doctor. They prescribed some medications. Nothing seemed to help. They tried a number of medications. They tried different protocols. Nothing helped. She had 3 exploratory surgeries. They couldn't find anything. They thought it was her ovaries because she started having menstrual problems with these abdominal cramps. They took out her left ovary. They took out her right ovary. They took out her uterus. She had 5 bladder surgeries, a total of 13 surgeries. Now she had no control over urinating. She had to wear Depends. She couldn't feel when she was defecating. There was no feeling. Couldn't have relations with her husband. She was so dry. She couldn't lubricate, and it was painful. She hadn't had an orgasm in 13, 15 years and was orgasmic with her husband before that. Even when she was suffering, still they had relations. Then someone said, "Why don't you go to my chiropractor? He helped me with a number of different things." So she went. All this chiropractor did was a little gentle traction. She's laying on her tummy. He did gentle traction. It's called COX, C-O-X, flexion distraction. And he had her do Kegel exercises, and he did gentle side-lying adjustments on her sacroiliac joints. When you look at the study on this, 25 years of bladder problems, gone in 8 weeks. This list, unable to feel when she's defecating, gone in 12 weeks. And the last one on this list, which always stuck with me, deficient precoital lubrication for 13 years, gone in 6 weeks. Even those cells on the inside lining of the reproductive tract started working better when this guy just did some gentle low back work and had her do Kegel exercises. She fell down a flight of stairs when she was 18. She knocked her back out of balance, but she didn't have back pain. So the title of the article, Mechanically Induced Pelvic Pain and Organic Dysfunction in a Patient Without Low Back Pain. She didn't have any pain, so nobody thought of her back. But the problem was in the function of the back. Those joints weren't moving correctly, which would cause some compensatory inflammation. The inflammation then inhibits the nerve flow to the area, and the tissue is not getting the correct message from the brain as to how it's supposed to function.
There's a whole industry making money on women's backs. And the fact that many hysterectomies are done because a woman has pelvic pain for unknown pain is absolutely insane. Laparoscopic surgeries just to investigate what's going on in there. I think that when we become better consumers and we start to question what is being recommended to us, it's the moment that we can make a better choice. We know that pelvic floor dysfunction and pelvic pain can be treated holistically and naturally with lifestyle medicine. So let that be the first line of defense. When it comes to birth control, it is not the panacea and the cure-all that women think it is. And I totally get that we want to have protection. But when I bring my daughter to the doctor and she's suffering from a certain condition and they say, here's birth control, then I say, no, I'm not going to do the birth control because there are side effects to birth control, right? And there are things that we can use naturally for birth control that doesn't involve taking the birth control pill, right? So I have seen so many women develop pelvic pain and infertility from birth control that I am one of those people that says when it comes to birth control, informed consent, like read the package, because when you read it, you're going to be shocked.
So when it comes to hormones, one of the things I always educate my patients on is a birth control pill as a fix for hormonal imbalance. Our birth control pill never fixes a problem. It just masks and suppresses your brain to not tell your body to release hormones. It says, I'm going to take over. You're not doing a very good job because this patient has symptoms. So let me just reset it and give it baseline, same level every single day, and have a withdrawal bleed. So you're not actually bleeding. It's not a true period when a woman bleeds. It's a withdrawal bleed of not getting those hormones. So I encourage my patients, if they have symptoms, if they have some sort of imbalance, whether their cycles are too long, they're not getting their cycles, they have painful cycles, they have breast tenderness, moodiness, PMS, any symptom is a sign that your hormones are off. And you don't want to reset and say, well, I'm just going to take over temporarily for now, because it has side effects. It depletes nutrients. It can cause anxiety. It can cause blood clots. It can cause death. It can irreversibly make you not to have a period again. And these are things I was taught were rare. But after 13 years of seeing patients, come to me, for example, for fertility, trying to conceive now that they're off the pill and they never get their period back. And they were told that there's no such thing as post-pill amenorrhea. Well, I'm going to tell you there absolutely is, and there are side effects. And I'm not against the pill. I'm just for consent and patients knowing what can this do to me, and then being able to choose if that's what they want to do. But often I'll look back at history and see that, wow, there was a hormonal imbalance from age 13, and no one looked at it. And 20 years later, being on the pill, now we've got liver and gallbladder issues to deal with on top of that. So it's a lot harder to fix.
And I believe when we look back at this era, when we look back at birth control, it's going to be a deep awakening for the future. Because right now, there's not that much data, or the data is being, how do I say this? It's skewed. You know, it's paid by Big Pharma. We really don't know the data. But when we look back at this, we're going to think it's one of the worst things that happened to women's health.
There's always a better way. There's a better way if it's an IUD that is non-hormonal, if it's and you're married and you're done having kids, whether it's your partner having a vasectomy, but it's your health. So this is synthetic hormones you're choosing to put in your body every single day, and that's just not how the body was formulated. It's not how it was supposed to be. So it has consequences. It has side effects. So I encourage people to just become aware of all these side effects and know that it can absolutely affect their energy, their health, and absolutely their fertility.
And as the physician who's writing this out, risk versus benefit. And informed consent is everything. And informed consent when it comes to birth control is critical because it's not right for the majority of women out there.
Every major fertility clinic that men go into tells them, get the phone off your body. Why? Studies have shown that if you take sperm from a man and put it in a test tube, one test tube gets exposed, the other does not. So you're actually comparing the same sperm. The exposed test tube, exposed to cell phone radiation, the sperm will die 3 times faster and have 3 times more damage to the DNA that fuels the sperm. You need at least 250 million sperm to make a healthy baby. You know why? Sperm don't know how to ask for directions. But the fact is, you want 250 million sperm minimum to make a healthy baby because you want the healthiest, strongest to survive and make the healthiest baby. What we know is that men who have a lot of devices on their bodies often have problems getting their partners pregnant when and if they want to. We did a study on testicular cells, which we showed are vulnerable to electromagnetic fields. But when we also exposed them to melatonin prior to the exposure to cell phone radiation or fish oil, there was almost no damage. Now, that doesn't mean that you can totally mitigate it. It just means that the things we talk about in healthy eating make sense in terms of their biological capacity to improve your body's defense against a lot of different agents in the environment. Green tea has a chemical in it that's particularly effective against the damaging effects of radiation. And a number of studies have shown this with brain cells as well as testis cells. Okay, there are studies, again, in animals, where prenatally exposing animals, you can produce animals with smaller brains, with smaller testes, and more damage in those cells that do exist. Particularly, studies done by colleagues at Samsun, Turkey, have shown prenatally exposing animals produces damage to the hippocampus. Now, what's the hippocampus? It's the part of the brain that controls balance and memory, impulse control, emotions. Pretty darn important. And we see in animals evidence that this happens. Now, we have evidence that parents, women that use cell phones a lot during pregnancy, produce children with more learning difficulties. And there's a suggestion that it plays a role in autism, which would not be surprising at all because the animal studies would suggest that's going to happen. You're going to damage the brain of a child by having prenatal exposure to cell phone radiation. Again, we're off the rails. Why do we insist on this proof of human harm before taking the step to reduce exposure? Now, I'm part of something called the Baby Safe Project, and we are working with more than 250 obstetricians, gynecologists, and pediatricians to promote awareness of the fact that you've got to protect the pregnant abdomen from cell phone radiation. It's a very large effort. If a patient comes into certain physicians for treatment, almost of any kind, increasingly the doctor will say, get the phone off your body. So there are more and more doctors who are telling patients to do this.
When a woman is seeking pelvic floor physical therapy, many times she'll need a referral from her doctor if she wants the insurance company to cover the care. So one of the most important things that women can ask is, what are the alternative therapies to what you are recommending? if the doctor is recommending some sort of vaginal suppository, like a Valium, right, for the pelvic pain to insert vaginally, maybe at that moment you say, doctor, thank you very much, but I would like to know what are the other alternative therapies out there. What is your understanding of pelvic floor physical therapy? And if the doctor doesn't understand, that's okay. They're not educated in this field. Many times they don't even know who to refer them to. But you can say, hey, I'm going to do my due diligence. Give me the prescription for physical therapy, and I'll make sure that when I find somebody, that they will call you back and you'll be in communication. And the other thing that I want to really talk about, which I think is super important, is when you do go to a doctor and they give you the wrong diagnoses, which happens quite often in the field of pelvic health. Go back and communicate with that doctor and say, listen, this is what happened, this is what I needed, and you need to know this. Do not leave a review on Yelp and think that that is enough. When someone misdiagnoses you, you need to go back. You need to say, hey, listen, if this is not your branch of field, you need to refer out. This is what happened to me. I went through 5 different doctors before someone can help me. Go back to those 5 doctors and let them know. Let them know your truth. Send them a letter if you don't want to call them on the phone, so they get the opportunity to change, because I believe that they want to do the right thing. But give them that opportunity, because if they don't know, they're just going to keep doing the same thing over and over again to the next woman that walks in the door. Other things that I believe are really helpful for women with pelvic pain is simple things like drinking plenty of water, which is such a simple thing, but a lot of women with pelvic pain sometimes also have bladder issues, so they restrict their water because they have urgency and they got to pee all the time, right? They go together. All women should be paying attention to their posture. Really important. Not pushing with urination and defecation, I think is really important. I think that destroys the pelvic floor. And so sometimes we're looking for these big, huge things that we're going to do, right, that's going to bring the profound changes in our health. And it's really the things that we do every single day, how we carry our bodies and how we bring that consciousness to our movement. One of the most important things when it comes to women's health that I think is vital is that you, 1, have to trust your practitioner. 2, remember that you are the consumer and you are buying healthcare. And as a consumer, you need to start behaving like one. And if a doctor marginalizes you, if a doctor poo-poofs you, or if a doctor puts you in the corner, if something doesn't feel intuitively right, if you get an inkling of a feeling that this physician or this MD or this practitioner is not the one for you, then that is the moment. Then you have to say, thank you very much, I appreciate your input, and walk out the door. I think so many times as women, we're so afraid. The doctor hands us the prescription pad. We take the prescription, we fill it out, and we ask no questions. And once we start to see ourselves as a consumer of medicine, and we start to understand that we have a right to informed consent on any drug, any procedure, any surgery that we're having, then that is the moment that we start to stand up for ourselves.
This was another jam-packed episode on a very important topic. Let's go over what our experts shared. First off, Issa shared that many women and men are afflicted with an invisible injury, and this is to their pelvic floor. The pelvic floor is a highly energized area and really is the basket of our being. So any dysfunction in those muscles can cause an array of symptoms. Dr. Mary shared that we have an entire network of biochemical reactions taking place that signal and coordinate our physiology, and these are our hormones. Hormones influence brain and nervous system development, thyroid health, blood sugar, metabolism, aging, fertility, you name it, hormones are there. And get this, They are easily disturbed by toxin exposure, poor eating habits, and especially excessive stress. So you may want to rewind to our first episode for some powerful stress remedies. We then launched into our first healing breakthrough, biofeedback. Dr. Pepper discussed the research on urinary incontinence and the power of pelvic floor biofeedback. Whether due to childbirth or prostate issues, this intervention can benefit both men and women. He discussed how something called learned disuse can contribute to this leaking effect, but believe it or not, in 4 to 6 sessions of pelvic floor biofeedback, research shows an 80% success rate. We then moved on to the use of acupuncture to treat infertility. Dr. Mel told us about some exciting recent research on acupuncture increasing the likelihood of a live, healthy birth in IVF treatment by 2.5-fold. Like any treatment, acupuncture needs to be properly dosed, and when used in conjunction with IVF over the course of weeks, the results are resoundingly positive, which is why results-driven clinics around the world have already implemented it. Then, Dr. Lisa Ann Comboy shared her personal story of how acupuncture helped her with her menstrual cycle challenges after years and years of standard medical care with no success. Chinese medicine did in 2 weeks what biomedicine could not do at all. Next, we move to medicinal herbs, which are widely embraced by cultures around the world for their beneficial effects on all aspects of reproductive health. Dr. Afruz Damari uses maca root for many of her patients, and also a specific product was named by a few of our experts called Feminescence. Then, David Winston, who wrote the book on adaptogens, spoke on the benefits of ashwagandha for the male reproductive system, increasing sperm count and motility, but it also works on analogous tissues in women. Next, chaste tree berry has been extensively studied and is shown to help with luteinizing hormone and follicle stimulating hormone ratios, and also supports progesterone for fertility. Next, Dr. Cannon, who specializes in traditional Chinese medicine for women's health, emphasized the importance of formulas over single herb prescriptions. For example, Dong Guai is known to regulate the menstrual cycle. However, when not balanced with synergistic herbs, it can create an irregular cycle. So, multiple herbs in a formula sometimes beat single herbs. Isa Herrera, a pelvic floor therapy specialist, then shared the ancient practice of yoni steaming. Remember, herbal medicine is not just about extracts and teas. With yoni steaming, aromatic oils are liberated and released into the air, and the power of steam heat reinforces the effects. Also good for men too, this technique allows our lower centers to breathe and promote circulation. Isa also talked about ergonomics and how we all need to be more aware of our posture. To that point, yoga asana or poses such as pigeon can be amazing for pelvic floor health. While in that realm, Isa asked us to bring mindfulness to those activities that cause you difficulty, to pay deep attention to the messages from your body, and to make simple changes. Gabrielle Kaufman, board-certified dance and movement therapist, then spoke on how dance is helpful along the entire reproductive journey. New moms and dads can benefit from this too, as your baby is learning through movement exploration and watching what you do. Our top modality in this episode, manual medicine, included ancestral interventions like Maya abdominal massage and newer iterations like chiropractic. Every internal organ has a natural range of motion or motility, as explained by Isa. Sometimes a malpositioning of the uterus is what's causing the problem, and this can be corrected through the use of hands-on manual therapy. The belly is the blueprint of the organ, so working with techniques that target this region can be very potent. Next, Dr. Tom O'Brien shared a published case report of how chiropractic spinal manipulations helped a 39-year-old woman suffering from years of bladder problems, IBS, anorgasmia, and progressive menstrual issues, all from a car accident when she was 18. These symptoms were gone in 6 weeks of chiropractic treatment. And we also received some empowering wisdom when we discovered that pelvic floor pain and hormonal issues are not comprehensively studied in medical schools. So many times, it's up to us as the patient to ask the right questions of our healthcare providers. Ultimately, your health is in your hands. It's your right, your body, your life. All right, that's a wrap. Our 9-part docuseries, Proven: Healing Breakthroughs Backed by Science, is officially complete. How are you feeling? Did you learn a lot? I've got to tell you, this information is my life mission. Natural and alternative medicines have had such a profound impact on my life. Without them, I'd be a much different person. Mentally, certainly physically, and also spiritually. There is an innate rightness or aha when we begin to work with the healing power that many of these practices unlock within us. These approaches help us realize that there's so much more beautiful complexity to our lives and our health than we were originally taught. Plus, now there's hard science showing they work. They are proven. Once you take that first step toward these tried and true solutions, you begin to take your power back and a world of truth opens up to you. Now, these episodes will be coming down shortly, but we've made this entire series plus a ton of incredible bonuses available to you at a special discount. Please click the button below this video to check out how you can get the full Proven docuseries plus a bunch of powerful bonus resources at a discounted event-only price today. When you buy it, you'll not only have lifetime access to everything you've seen in these episodes in 3 different formats, I might add, video, audio, and text transcript, but you'll also get ebook guides on how to use alternative medicines for specific conditions, extended interviews on topics that weren't covered in the episodes, and 2 live Q&As with some of the esteemed experts from the series. If you're excited about the work we're doing, this is also the ultimate way to help us create more episodes like the ones you've been watching. The full series is only available at the special discounted price during this event only, so make sure not to miss it. Lastly, thank you so much for tuning in. We created this series to shine a light on a new hope for human health, and we're so honored that you gave us your time and your presence. The journey to discover and embrace these powerful medicines and lifestyle habits has only just begun, and people around the world are beginning to bring these tools into their lives as we speak. The question is, are you with us? Our warmest regards to you and yours. Remember, stay curious.